all these people, and probably more die. They die. I'm Dr. Emily Porter. I'm a board-certified emergency physician in Austin, Texas. Right now, we're in the middle of this coronavirus outbreak, and everyone is really confused because they don't understand why are the bars closed? Why is everyone hoarding toilet paper? Why is my gym closing? What does social distancing mean? What does flatten the curve mean? And isn't this just like the flu? Because why is everyone panicking now and they didn't panic before? And I'm going to show you on my whiteboard why doctors, governors, and other people around the country are concerned about coronavirus and why every American should be, and really everyone around the world should be. So numbers wise, in America, we have 331 million people. The CDC is estimating that about 40 to 70% of them will get infected. So I'm definitely a glass is half full kind of person. So to make the numbers easy, I'm going to say that it's 150 million people. 150 million infected. That's about 45%. So on the lower end of that 40 to 70%. So if 150 million people get infected, 80% of them are going to be just fine. So 20% of people will need hospitalization. Italy has a big problem right now, and they don't have enough hospital beds for people. Well, they have more hospital beds per capita in Italy than they have in America. So they have more hospitals, more doctors, more people to take care of all the sick people than we do in America. So 80% fine, 20% need a hospitalization. 5 to 10% of the 150 million that get infected are going to need a ventilator. So ventilator is also called a respirator. You've heard life support. That means you're going to take somebody, put a breathing tube in their trachea and help inflate their lungs. Let's say 5% of the people need ventilators. Again, glass is half full. So 5% of 150 million people, 7.5 million vents needed in America. These people get sick, the only way they're gonna live is if we have a ventilator for them. So we need 7.5 million ventilators. So I started thinking, well, how many do we have in America? Like, I'm in Texas, it's a big state, we've got a lot of big hospital systems. We probably have more than enough to take care of everybody. What's this flatten the curve business? They're blowing it out of proportion. So I looked it up. And in Texas, we only have about 4,000. And so America-wide, we have they estimate between 72,000 and 120,000. So we're gonna round up because we're optimistic and say this is the number that they have in hospitals right now. If they pull all the ventilators out of storage, if they take all the ventilators out of the operating rooms, if they suspend all the elective surgeries, and they take everybody who's currently on a ventilator, because there are people, our hospitals are full. There's people that have had a heart attack, or there's people that have the flu that are currently using ventilators or respirators. But let's say that they're completely empty. Then we pull all these ones out of storage, we have 120,000. We're gonna say we have 150,000. We're gonna say that the government finds a way to find 30,000 of them real quick. If I were to give you a percentage of 0.02% of people could get a ventilator if they needed one, right? That doesn't sound that bad, but what if I told you that 1 in 50 people who need a ventilator can get one? What does that mean? That means that 49 people out of 50 are gonna die because we do not have the respirators and the ventilators to take care of them. That is scary. That should scare you. That scares me. That should scare everybody who can understand basic math, including my second grader, that 1 in 50 are bad odds. Unless you want this to happen, unless you want somebody to decide whether you're worth saving, or your dad, or your sister, or your baby, or your grandma is worth saving, you have to do your part to prevent us from having to make these decisions, because we're heading there, and we're heading there very, very quickly. So you've heard about flattening the curve. This is what that curve means. The number of cases of coronavirus, if we don't do anything besides just what we've been doing, if we follow other countries' leads, it's basically exponentially growing. It means it doubles to triples every 2 days or so, roughly. And this is the healthcare system capacity. That's a line. And what that means is this is all the personal protective gear that we have, the masks, the the gloves that everyone ran out and bought so that now they don't have enough at my husband's hospital, all the N95 respirators, all the things, including the ventilators. This is our healthcare system capacity. And if we don't do anything without protective measures, we're going to end up here, above the ability to take care of everybody. What that means is that all these people, and probably more, die. They die because we don't have ventilators for them. And we have to start playing Russian roulette of who's going to get saved. Is it going to be the person who's been there the longest? Is it going to be what if you have somebody on the vent? Who's going to unplug your dad? My dad's 72, he's got a heart condition, he'll get unplugged. It's the reality that we face. It's awful, and I don't want it to come to that. Doctors are gonna have to make those choices. Now, if we have protective measures, we're still gonna have cases. This is a highly infectious virus. It's way more infectious than flu. Children don't die from it, so that's fortunate, but children often don't get symptoms, and they spread it more than other people. So they're danger to adults, and especially to elderly adults. So, my mom, she doesn't get to see her grandbabies for a month or more, we don't know, because we're practicing social distancing. We're not going out of the house except to the grocery store to go for a walk. Those are the protective measures, as well as hand sanitizer, washing your hands, covering your cough, sneezing into your elbow, all those things that we as Americans can do. And I get it, it stinks. My spring break got canceled. My kids are devastated. I don't want to homeschool children. I work full time. I'm not saying it's ideal, but it's what has to be done, the experts are saying, to prevent this from happening. There's a million reasons to be angry and unhappy and just think that this whole thing sucks, because it does. But what really sucks is losing 47 million people. So I'm washing my hands, I'm doing my part, and I'm also just listening to what I'm being told by the experts. This is about everybody coming together for the common good, that we want a future for our children. And it's 2 weeks, man. It's 2 to 4 weeks. And I hope that if you care about anybody other than yourself, including especially these 47 million Americans, that you will also do the same and just not complain about it and just do it, because it's what we got to do.